Hello all, welcome back to my channel, and in today's video we will be discussing about cognitive therapy per se, not combined with behavioral therapy, that is CBT. We will be discussing only about cognitive therapy in this video. So cognitive therapy is a type of psychotherapy which was first developed by American psychiatrist who was very famous, called Aaron T. Beck, who gave the negative triad model. We shall discuss about that in detail in a while. And there is also another important model given by Albert Ellis, that is ABC model, which would support cognitive therapy as well. So this therapy focuses more on changing the negative thoughts or thinking patterns or distortive thoughts of the client, which can be corrected by inducing positive and new thoughts. So now let's see what the cognitive triad is. So it is about the client having negative thought towards three aspects. One is self, next one is the world, and the future. Self is nothing but the client blaming himself for a failure that he has faced. Second is he would blame the world, my family is the reason, or my workspace was the reason for my failure. So all that thoughts the person would have. And last one would be on his future, like I am bad at this, I cannot achieve anything in my future, I don't have a proper future. So all these feelings, negative thoughts come into their mind, and this is what the therapist is supposed to correct. And now let's see Albert Ellis ABC model. So A stands for activating experience, B is for beliefs or thoughts which are irrational, and C stands for consequences. So now let's take an example and discuss these three aspects. Say a person sees a dog and suddenly the fear activates in him as soon as he sees the dog. So this is the activating event is what we can see. So now the way he reacts to it, or the beliefs or emotions he get after looking at the dog, is what matters a lot. And now the person would feel scared and also feel other symptoms like fear, anxiety, giddiness or shivering and all of that. So there's something negative thought that the person is getting about that dog. And now the consequence is the man reacting to the situation in a positive or a negative way. So if the person have had and bad experience, past experience with the dog, the person would definitely not like to have any such bad encounters with the dogs again in his future. And now that one bad experience of that person with the dog has led to the overgeneralization in that person. He feels like all the dogs are bad, and now it's the therapist's role to play. So they will have to make the person understand that that is not the case. I mean, all the dogs are not bad. All that thoughts have to be removed, and something new, something positive thing has to be put into the person's mind. So this is what cognitive therapy relies on. Now let's understand what happens in cognitive therapy. So these sessions are generally involving patients and counselor or therapist in one-on-one session. So there are many sessions that happens in this therapy, and the therapists get to know their clients properly and then work on their thought process or thinking pattern. And the main idea behind this therapy is to change the negative thought process of the person and make them realize what is causing them the problem. And cognitive therapy is half part of CBT, that is cognitive behavioral therapy is what we can say. CBT is more dependent, or the idea behind CBT are two approaches, that is to change cognition and the behavior of the client. But here the therapist will emphasize only on the thoughts of the client. So it is only cognitive therapy. Cognitive therapy benefits the clients in many ways, and it is used to treat different issues like depression, addiction, bipolar, that is both depression and mania together, phobia, substance use, and many more psychological and mental problems. And now let's see the advantages of cognitive therapy. Cognitive therapy is as equally effective as medications. Sometimes it also work better than medications, and number of sessions are less in this type compared to other talk therapies that we see. And this therapy focuses on changing the negative thoughts. No, it doesn't rely more on behavior. It is only emphasizing and deliberately looking for the change in the negative thoughts of the client. And there must also be disadvantages if there are advantages. So though there are many benefits compared to disadvantages in this type, this therapy is not suitable for everyone, and clients' commitment to the therapy is also very much needed. All these factors come into picture when something has to be successful, or if the therapy has to go on successfully. The client's interest, the therapist's skills also very much matter here. And finally, cognitive therapy encourages patients to improve their quality of life, allowing them to be in better mental health for their future. So this was about the video. Thank you for watching. Please like, share, comment and subscribe.